All right, we're going to go ahead and start now. And so the first question.
Hey, this question's for Bret. With regards to the coronary calcium screening in middle risk patients, I can envision 4 scenarios, and 3 of them are kind of straightforward, but the other one isn't, in my opinion. So let's say you have a high score in a patient that's on a statin. You're probably likely to leave them on a statin. A high score in a patient that's not on a statin, maybe you put them on a statin. If the score is low and they're not on a statin, that's easy too. But what if they're on a statin with a low score? You don't know if, theoretically, you don't know if they're low because they've been on a statin or because they don't need a statin.
Yeah, so great question. So the first thing I would have to say, though, is it's not so simplistic as just a statin, right? I mean, a statin is one part of the puzzle, but it really is an entire lifestyle risk factor modification, risk factor assessment. But so I can't answer the question without throwing that in there. But as it refers to a statin, statins actually have been shown to increase calcium scores. So if you take somebody with a low calcium score, you put them on a statin, their calcium score will naturally increase even if they don't have an increase in plaque. Now, part of the theory is that it calcifies softer plaque, so maybe it's a good thing that it's stabilizing plaque. Maybe it's the negative side of that would be saying, well, maybe it's contributing to vascular injury, causing more calcium. We don't know the mechanism. It's all sort of theory and hypothesis. But if somebody had a low calcium score on a statin, I would say I would be in favor of stopping that statin and repeating the calcium score down the road to see if it changes. And that's one certain option. Because like that slide I showed, for people who had a calcium score of 0, there was no 10-year benefit in reducing cardiovascular events with a statin. Now, your point is a good one. Was it the statin that decreased, or was it the statin that prevented plaque formation, and therefore that's why the calcium score was 0? I mean, again, that's a hypothesis, and I would argue against that hypothesis, and I would say it's more likely that you're just not developing plaque and you don't need the statin. Either way, the way to know is to do your own N of 1 trial, to figure it out. But in, the right situation with the right patient, I would definitely be in favor of stopping a statin in that scenario and seeing what happens.
I'm sad Ivor Cummings isn't here as well, but my direction was to Dr. Scher also about the glycocalyx. Is there a difference between the arterial versus venous glycocalyx? The effect of bypass grafting on it? And is there any new research supporting hope for reopening clotted vessels?
Okay. All right. The difference between arterial and venous glycocalyx, I have to be honest, I have no idea if there's anything out there about it, because the only thing I really see is arterial glycocalyx talked about. I don't remember seeing anything about venous glycocalyx, because the vessel wall is much different in an artery and a vein. So when you talk about bypass grafting with a vein, where they take a vein from your leg and they bypass your artery, so you've taken a venous structure at low pressure and turned it into an arterial structure, which now is higher pressure. So one thing that's very interesting about that is your veins don't get plaque. Your veins don't get blockages in arteries. Or sorry, they don't get blockages and plaque buildup, but your arteries do. Now you take that vein and plug it into an arterial system. Now all of a sudden it does get blockages. It does get plaque buildup. Is it just the pressure? Is it the difference in the type of blood? I don't know that that's completely proven, but the point is it changes. And again, I apologize, I don't know how the glycocalyx is affected with that. The third part, evidence about opening completely blocked arteries, that's a big thing. There's the OAT trial. There are trials to say if you have a completely blocked artery, your coronary artery, your body's usually pretty good about forming collaterals to that area. So are you better off opening the native vessel to give it more blood flow, or are you better off leaving it with the collaterals? It's a moving target. I can tell you my personal belief is if you're asymptomatic, you don't have heart failure, not having angina, it might be better off just to leave it closed and let the collaterals form. Interventions for chronic total occlusions are complicated, they're risky, so you always have to ask yourself, is the benefit worth the risk? Now, if you have intractable heart failure, if you have intractable angina, completely different story. if you're feeling other methods, then it's worth opening that artery. So it was, yeah.
Hello, my name is Cynthia, and I have a couple of questions. I don't know that I would direct it to anybody in particular. I suffered a hemorrhagic stroke in 2014, and I've also been on hormone replacement therapy since 2013. And I was wondering about tapering off of hormone therapy and also antidepressants with those things in mind, and how that would correlate with doing keto.
Yeah, that's pretty complicated. I got to be honest with you. I don't know that anybody would be comfortable giving us specific advice about that. Hormone replacement therapy is a complicated topic with lots of benefits, lots of overblown risks. It's got to be individualized for each person. Keto therapy or ketogenic diet can certainly help hormonal regulations, but it's a very individualized thing.
So like you said, without being too specific, because it is complicated, I think you got to step back and ask, what are your goals? What do you want? Is it longevity? Is it quality of life?
I just don't know how safe it is to be on hormones for the rest of my life.
What's your fear? What's your worst case scenario? What? Obviously, we all want to live. I understand that, right? But at the same time, I mean, it's complicated. There's not an easy answer.
Mm-hmm.
I think you got to step back and realize what makes you happy. What do you want? And then you'll have a better idea of where you prioritize things. And honestly, trying to get as much information as possible. But yeah, it's hard to give specific on that situation.
Actually, one little plug. Peter Attia has a podcast called The Drive. Some controversy about his cholesterol version of it, but one of the ones that I recently listened to was the hormone replacement one, which I thought was excellent and really pulled the wool off of a lot of our eyes about how we've been misled about hormone replacement therapy. So that might be worth looking into. I think that was worthwhile.
I have two questions. One of them is for Nurse Cindy. On that DEXA scan, I didn't know that it could tell you how much weight you have left to lose.
So the DEXA scan that I had, it looked at bone, your bone density, as well as he could show me areas where I still had fat accumulation, and he was able to draw these little markers around it, and then it calculated out what my percentage of total body fat was versus lean mass. So he and I discussed what were my goals, where did I think comfortable. He says and he showed me exactly where. We won't talk about that. But it was a choice that so for me, 20 pounds would be great, but and I now know that I need to build more muscle to increase my metabolic furnace, and so it was really quite interesting to see myself like
So
that.
is that a standard DEXA scan, or do you have to ask for something
It was,
additional?
you know what, if you post that on my Facebook page, I'll get in touch with him again and see what type of machine he's using,
Okay, thank
because
you.
he said it was like of course they all say that, but
Okay, and my other question is, I've watched Dr. Berry talk about A1Cs and getting it under like 5.4 or 5 point. And so my three brothers all are pretty bad diabetics. And when I talk to them about it, they tell me that their doctor tells them to get their A1C to 7. Why?
So let me make sure I understand. So somebody's telling you or giving you guys it should be as low as low 5s, but their doctor is saying it should be just lower than 7? Okay.
Yes.
Yeah, I mean, basically, yeah, that's where things are right now, where we don't think big enough, I guess, right? I mean, I got diabetes and I'm on insulin, and a lot of people don't realize that you can make it go away. So instead, we just think, well, 7's good. There's less macrovascular complications, and it's like that.
I had a slide on my talk that sort of addressed this. And part of the problem is the studies that have looked at treating patients with type 2 diabetes aggressively with insulin and with sulfonylureas and other drugs that increase insulin showed absolutely no cardiovascular or mortality benefit in reducing the hemoglobin A1C below 7. So that's the drug-centric focus of treating a problem with too much insulin with more insulin. So that doesn't work. Now, if we reverse that and say, what if we could treat it in a way that lowers insulin, treat it with lifestyle rather than drugs, completely different scenario. So a lot of the official recommendations are still you treat to a hemoglobin A1C of 7 because it doesn't benefit below and you can risk hypoglycemia. None of those hold true for lifestyle, and that's how we have to reframe our focus.
Hi.
One more thing on that. So, like he mentioned, you definitely want to get rid of medications like insulin, fiber, anything that's stimulating insulin. Okay, everybody's situation is going to be difficult as far as how advanced or complicated their diabetes is. But there's still some good medications out there, so then you have to go personalize it on how realistic is this person going to be at intensive dietary and lifestyle changes. They may need more medications, but in no way would I use anything even close to that stimulates insulin to make the A1C better for my comfort, or I'm not sure.
Hey, I'm Amy, low-carb nutritionist. This question is for Carole and/or Cindy. Would you please say something about setting realistic expectations when it comes to fat loss, whether on a ketogenic diet or any other nutritional plan? Thanks.
Well, yes, because everybody online is losing 30 pounds a day. Why aren't I losing that fast too? So one of the things that people need to realize, so they say everyone online is losing this much so fast, but 1% of the people are losing that fast, and they're the ones that are posting and boasting and bragging and Instagramming all of that. And so people get the perception that that's how fast everyone is losing. But 99% of the people are losing it slow. I think Dr. Nally is the one that talks about long-term. He sees, up to 5 pounds per month is the realistic expectation of weight loss on a ketogenic diet when it's properly formatted. So yes, there's a lot of false expectations, but it's because people out there are posting that are losing it really fast, and then everyone else thinks there's something wrong with them.
My biggest thing, where'd she go? Be realistic. The reality is, if you're bored like me some days sitting in the airport to catch a flight, and you click on those people that say they've lost 30 pounds 3 months in a row, they're down 90 pounds in 3 months, and you go back through their news feed, bull hockey. They are attention seeking, most of them. Now, I'm not saying that no one does, but the vast majority, I'd say at least 80% of the people that I've tracked back on their news feed and looked back, they did not. They've either totally made it up. So, and I'm sorry that social media has perpetuated that I'm never enough. My efforts are never good enough. But that's where the scales, we just can't trust them. Because if your metabolic markers, if your A1C is coming down, if your arthritis pain is less, if you have more energy, you're sleeping better, less brain fog, that's the goals that are going to be the parts that keep our life. Does that make any sense? So it's just, please encourage people that say, but they're losing it, say, go back and look at their timeline. Very few do. And if they are, they're in their 30s and they gain 30 pounds over a pregnancy, most of them. It's slow and steady. You just got to be consistent.
One more thing on that, I would say, because everybody fixates on the scale. The scale trumps all, I guess. I don't know. But I really focus a lot on measurements. So waist circumference, hip circumference, all that kind of stuff, because that's stuff you can't really fake. So, and sometimes we can use body impedance scales, but they're not always perfectly playing out, especially with water fluctuations and whatnot. But if you are consistently knowing that you're eating how you should and following as best you can, and you're noticing your clothes are fitting differently, and you're measuring and you're seeing that change, trust it.
Have you been awake the whole time?
Actually, if you've been following my Twitter, I had the best night's sleep of my life in like the last 3 months. It was fantastic. Actually, if I can actually add a little bit, because this is something that comes up a lot within my own family. I think that too often people become obsessed with comparing themselves to other people in a weight loss journey, right? And the issue is we are very adaptive as humans, which has kind of been both our greatest strength and our greatest weakness. Where it's our greatest weakness is you could have tried 100 different diets, all of them failed, and you're actually having the best success of your life on keto, and somehow you've managed to think it's a failure because you're comparing yourself to your neighbor or your sister or your daughter or whoever it is who seems to be showing greater success. And it's very frustrating for me to see with other people because you just absolutely have to compare yourself to where you started. And if you keep losing sight of that, you have to realize that that's that comparison. We always think of things, in comparison to the Joneses. And there's amazing success that I'm seeing in my family in ways that I feel like I have to keep reminding them of, because they keep doing the same thing. They keep looking online at these other Instagrams, these other Facebook posts, and it sounds as if some people online are sharing these miracle stories, and now they want a miracle story. And it's always your own personal journey. Anyway, I'm sorry, I just had to fit that in because I feel like it's so important. Cindy, I really wanted to compliment you on your talk, because while it may sound like the conversation of weight loss itself is something that's already getting battered like crazy, and we're hearing about it all the time, you've shown us a story of camaraderie among your family. So much happened on so many fronts with so many lives. So I just really want to commend you for bringing that to us. I really appreciate you carrying that story.
I'll add to what Dave said there too about women comparing themselves, especially, and we feel like there's something wrong with us. Like, why are they losing weight faster than me? I hate her. It's so easy. Like, what's wrong with me? Why can't I do it that way? And so a lot of times I'll give them an example of childbirth with women. Every woman who's had a baby, it's a very individual, unique experience. And some women, their baby is there in 40 minutes, and some women it's days, and they need other interventions. And you don't hate somebody because their journey was different than yours. You end up with, for the most part, a beautiful baby at the end. And just embrace the process, and you're going to get there eventually. And everybody's journey is totally different. And so stop comparing yourself to someone else.
So definitely a topic worth talking about more. You got to understand, I don't know if maybe you've read Dale Carnegie, How to Win Friends and Influence People. Phenomenal book, but it really hammers in the point that we all want to feel important. We all want to feel recognized, like we matter. Okay? So there's a lot of people online that are searching for that. They don't have it in their personal environment, but they can go out into this digital world and put it out there, and they're going to get attention. They're going to get this, and they feel good, and they'll do whatever it takes sometimes to make that happen. At the same time, you see somebody who's seen this big change, whatever, I promise you that's not the one picture they took. They probably took it from every possible angle, everything to make it look perfect. Okay? So if we're looking at this all the time, it's like, no, like I said before, I'm not enough. That's how we feel, because, how can we compete with that? So it's about the little victories. There's just so many other things.
So true. I take the world's worst selfies. Pretty bad. Take 100, save one. Right? Yeah.
Hi. So based on Appendix E of Ivor's book, I'm on a self-imposed protocol N of 1. I'm off of the industrial seed oils for 3 weeks now. And I'm wondering if anybody on the panel would like to comment on their practices and if they've seen changes in some of their clients, even if it's anecdotally, for people that have been able to remove seed oils from their diet.
You're saying just remove seed oils? Yeah, I'd say for me, if there's two things that you got to make sure you always do is no sugar, no processed vegetable oils. Those are pretty solid if you want to get rid of inflammation. And inflammation is a lot of issue people have. People are surprised when you get rid of those things and all of a sudden, some foot pain I have is gone. It's like, it's bizarre.
Last question.
So it's not actually a question, but just one thing I wanted to add on to Dave's comment was, in this day and age, losing and sustaining weight loss is a miracle story. Reversing diabetes or autoimmune issues or chronic pain, that is a miracle in this day and age, and people should be proud of that, regardless of comparing to other people. And the other thing I wanted to comment on, I talked to you in private about this, but you mentioned that, Cindy, that some people can have issues eating too much, but one thing I've also noticed, especially in the carnivore community, is if they're eating like one meal a day or whatever, they can sometimes undereat, and this can also lead to stalls. So just another self-experimentation thing you can try. Might be helpful.
And I think if any of you follow Christy Honeycutt Sullivan, she and I have become friends, and we were talking about we're worried about some of the it almost appears that some people online are trading one disordered eating thing for another. and I'm only going to fast, and I'm only going to do 1 meal a day, and I've got to do 3 days. So we just need to caution ourselves that we don't fall into a trap of this becoming an obsession where you're not even reaching your goals. So I don't know if you've noticed that, but there are some folks that are, if you've had some weird relationship with food, it's important that we're transparent and vulnerable, like you said, and share with each other. I'm not there, I'm struggling with this, but not get into this trap that this is the only way to do it.
Again, we're all different, and we're all going to find our ways to cope. Sometimes when somebody's been eating a certain way for so long and you put them on keto, it's like a scramble. Like what can I have? Like, and we find whatever it is to kind of fill that gap. Right. And then we finally kind of work through that stuff. But kind of your other comment about it being a miracle journey, yeah, it is not easy at all. You have to treat it like you're Everest. What would you do to prepare for Everest? You would do a lot of stuff. You would read everything. You do everything. You do all the stuff because you don't want to die up there. You don't want something horrible to happen. You want to do it safe. You want to do it right. And you got to treat it like that. I mean, we just come into rogue and just like, I'm going to do it. And then we're surprised when we fall and don't get back up.
You took a Saturday and maybe a Friday and a Saturday because you're committed to your health. Be patient with yourself. Be kind to yourself. Continue to learn. And I'm just so glad to have met as many of you as I have, including the other speakers.
I totally lied. There's one more question, and it's a good one.
Total lie.
Well, this is an add-on to the last question because I had lost 135 pounds just doing low carb, not high fat. But I gained some back through pregnancy and having a baby. And since I've had him, I found that it hasn't worked. So is there a minimum? Because everyone says eat more fat, but then you'll hear don't eat too much fat. So I've had a hard time navigating exactly what will work. I'm really good at I do daily affirmations and things that as far as self-love and investing in myself, I feel like I've come a long way. But I feel like I'm good at following instructions, but I feel like there's so much information that's conflicting. So is there a minimum of how much fat? You can overeat fat, but I've done 10 different apps where it tells you to put in macros. They all are wildly different. Anywhere from 1,200 calories to 1,800 calories, from 70 grams of fat to 120 for my body. So it's hard for me because I see a lot of this right now, apart from the initial whoosh, right, when I went low carb. So that was my question, is if there was a minimum, because I think trying to navigate that is, maybe it's just me, but I would think it would be hard for other people too.
Yeah, no, it's a good question. I think when somebody's very first starting keto, that you probably have a lot more fat. And as you get further along, as you keto adapt and all that, you can find ways. But it really comes down to what's your body asking for? What does it need? How are you feeling? I think, and people may think differently, but I don't really like giving people a certain amount of fat grams like that. I don't really like talking about calories. But they matter. Calories do matter, right? It's definitely not everything. We want to control a bunch of other things, right? And I like to do a lot of passive things that just result in your calories being lower intuitively. You're just not hungry, you're not eating, or you're intermittent fasting, or you're noticing that, hey, did you know that cup of macadamia nuts is 950 calories, right? So, sometimes just being more aware and present of what's in what. Because, a lot of times when people are munching on nuts, it's those behaviors, those habits, those things like that, where they're not really hungry, right? So, if you're doing everything perfect, but you go and snack on high-calorie keto foods, there's still calories.
Probably one of the biggest misconceptions about a keto diet is that you've got to eat a lot of fat and you got to get a lot of fat. So ketosis is about what you're not eating, not about what you are eating. And so I guide my clients like Dr. Trujillo said, in the beginning, often higher fat intake is helpful with satiety, but then dialing that back over time ends up helping facilitate better results. And so if you find yourself that you're adding a lot of fat extra to meals, if you're drinking fat, if you're having a lot of fat bombs, those are kind of the first places to kind of cut things back. And don't ever feel like you need to force the fat in. I think Dr. Nally yesterday was the one that talked about how, ribeye and bacon, and these things are already in eggs. They're already a perfect keto ratio of 1 to 1, so there's no need to add extra fat if you're feeling full and satisfied from those.
I think a lot of people get mixed up because they see these macro graphs and they think, okay, 5% carbs, 20% protein, 75% fat. I'm not getting enough fat. I gotta put more fat in there. And I go, yes, it's keep it simple. I mean, keep your carbs wherever that guides you. With protein in moderate range, so you can maintain muscle mass but still see your goals. And then fat is to satiety. Listen to your body. It's so complicated with all the other factors. Like I've said, like untreated sleep apnea, so many different things affect hunger, and so it's complicated. But I think the biggest mix-up is people get fixated on that graph. So stop looking at the graph.
And last but not least, congratulations on 135 pounds. If you stayed there the rest of your life, if you were at this health the rest of your life, would that not be fabulous? Okay, so stop. No but, no however, no nonetheless. Those of you that don't have access to wonderful guys and gals, doctors that understand this, go Google Dr. Eric Westman, listen to his white coat lecture, and find page 4. Go back to the simples, go back to the basics. Don't worry about the macro calculators. He has what he calls page 4 of his patient handout, and it's very simple. And the stress alone could be causing an insulin release, like cortisol. So just, it's good. You're doing great. You're doing great. You're welcome.
Thank you guys so much.